And now, we bring you the following live press announcement from D.C. Mayor Muriel Bowser. Our regularly scheduled program will resume following the announcement.
Good afternoon, everyone. I'm Muriel Bowser. I'm the mayor of Washington, D.C., and I'm joined today by Dr. LaQuandra Nesbitt, the director of D.C. Health, and Dr. Chris Rodriguez, the director of DCH SEMA. And we're here today to provide a brief update on the district's response to COVID. And let me apologize for getting started a little late, and we're going to jump right into it. I'm going to ask Chris to lead us off.
Thank you, Mayor Bowser, and good morning, everyone. What you see here are the metrics that we updated for this morning, along with 4 categories: level of community spread, health system capacity, public health system capacity, and community engagement. I'd like to ask Dr. Nesbitt to speak a little bit more about our experience with the virus.
Sure, thank you so much, Chris. So as you all can see, we provide our metrics there. I do want to notify you all that last evening we did receive notification from the CDC that the 2 of the variants that have been of concern in the U.S. have been detected in D.C. residents. We are still gaining more information. The 2 variants that have been detected are the ones that are more commonly circulating in the UK and South Africa. And as we have more information, we will provide that. What is important to be reminded is that as we learn more about the impact of these variants on our case trends in the United States, is that we want our residents to continue to be vigilant against COVID-19 and the spread of COVID-19, which means to wear your mask, keep your distance or maintain your physical distance of at least 6 feet, to be mindful of the types of activities that you participate in with individuals outside of your household, which means to continue to avoid large gatherings and to be very selective about the activities that you participate in. And more importantly, as you all will note, that we've had a decrease beyond our goal for phase 2 in the number of individuals who are participating or responding to our calls from our contact tracers and completing their interviews within the first 3 days of being diagnosed, is we want to remind people to answer the call from the DC COVID-19 team. This is extremely important in our ability to be able to quickly diagnose, have people be isolated and quarantined when they are diagnosed with COVID-19 or are a close contact. So please answer the call from the DC COVID-19 team. Thank you, Chris.
Thank you, Dr. Nesbitt. I think it's also worth noting and underscoring the importance of the getting back to the basics. We are certainly grateful to all DC residents and workers who almost a year into this pandemic are doing everything that they can to stop the spread of the virus and protect themselves and our community. And we continue to ask and to remind our friends, our family, our coworkers to please follow those basics that you see there, to wear a mask, to keep 6 feet of distance, and of course to wash your hands frequently and thoroughly. We'd now like to turn to some updates on vaccines. Next week's vaccine allotment is up approximately 50% from 2 weeks ago, and at this pace we do expect to have approximately 40% of our seniors vaccinated by the end of this week, and about 70% of seniors vaccinated by the end of this month. Here you can see where next week's 14,275 doses will be allocated. The 5,100 doses that will be used for appointments made through vaccinate.dc.gov and the call center include 200 doses received through the Federal Pharmacy Partnership, and these doses will go to and be administered by Giant. Of course, as we've mentioned throughout these press conferences recently since the vaccine was made available, our supply continues to be our greatest barrier to getting more people vaccinated here in D.C. And yesterday, Mayor Bowser, along with Governors Northam and Hogan, sent a letter to FEMA to request that the federal government directly supply and distribute COVID-19 vaccinations to essential federal workers in the National Capital Region. This request includes employees and contractors of the executive branch, the legislative branch, the judicial branch, independent agencies such as the United States Postal Service and the Federal Reserve, WMATA. And if FEMA is able to do this, that's good for our entire region. And it's good for our federal government, and it will better enable us to continue moving through our tiered phases. As we've been doing every Thursday, today we opened up appointments for seniors and healthcare workers in priority zip codes. We had 2,500 appointments available, and tomorrow we will make another 2,500 available to seniors and healthcare workers in all zip codes. We also announced that starting next week, to accommodate increased vaccination operations, we will begin using the Lamont Recreation Center instead of the Hattie Holmes Wellness Center. DC Health is working with Safeway to notify any individuals who had appointments scheduled at Hattie Holmes of the change. I just want to take a moment, and I know the mayor and Dr. Nesbitt also would like to thank our seniors for really leading the way on this vaccination effort. We know that for our community and for our residents, and specifically for seniors, that this is a stressful time. It's been a stressful year, but we want to assure you that we are making good progress. Already 1 in 3 seniors are vaccinated. And like I said previously, by the end of this month, we will have about 70% of all seniors vaccinated. So keep working with us, keep signing up for vaccinate.dc.gov, get your appointments, and we'll get you your shot. In the coming weeks, we're also going to be making some updates to how residents and workers can register for the vaccine. Dr. Nesbitt shared some of this with members of the council yesterday, and I'll ask her to just give a brief update now.
Sure, thank you so much, Director Rodriguez. So we have been providing updates about our plans to continue to improve the experience, the user experience with our portal, both the vaccinate.dc.gov portal and the call center, the multilingual call center that residents can access at 1-855-363-0333. We continue to make incremental improvements to that system, including today where we were able to make an enhancement that allowed for a set aside of appointments that would be accessible only through the call center compared to appointments that would be accessible via the online portal. We have been asked about our ability to allow a separation of the registration and the appointment scheduling process, and we are on target to have that process begin in early March. I will emphasize that this is not a wait list. A wait list would be that individuals would come onto the system, would essentially get in line for a vaccine, and based on the number of doses that we have, would be assured that at a specific date or time, or based on when they register, would be vaccinated sequentially. Our process will continue to apply an equity lens, and that when individuals register using a combination of criteria, including their qualifying eligibility phase, their geography or zip code in which they live, based on that zip code's priority in the city, and when they register will be used to determine when they are eligible for a vaccine appointment. So again, our pre-registration process is not the same as establishing a wait list, but it does allow an individual to signal to us as a government that they are interested in the vaccination process. And when we are able to give them access to appointment scheduling, we will do so. Thank you.
Thank you, Dr. Nesbitt. And before we take questions, we just want to present a few general updates. We're going to start with an update on DCPS for next week. As planned, there will be no classes on Monday in observance of President's Day. On Tuesday, classes will be all virtual to better accommodate teachers and staff who will be receiving their second dose of the vaccine on Monday, and classes will resume as normal on Wednesday. And because meal sites will be closed on Monday, students and families can pick up additional meal kits tomorrow. This week, also, the Metropolitan Police Department announced a new task force that will be focused on addressing the increase that we've seen in carjackings, auto thefts, and the unauthorized use of vehicle offenses. MPD is also engaged with our partners at For Hire Vehicles, the Office of the Deputy Mayor for Planning and Economic Development, to alert local businesses and reach out to delivery drivers about how they can stay safe. Because the goal is to both address the ongoing crime and also to share information that can help protect themselves and their property. You can see some of the tips here for staying safe. And finally, we want to thank our seniors who joined the mayor for yesterday's budget call. We also invite everyone to join us at a virtual budget engagement forum next week. As many of you know, the budget engagement forums are usually one of the mayor's favorite events. And even though we can't be together in person this year, we very much look forward to hearing your ideas. So please go to budget.dc.gov to learn more about how you can join us. So thank you, Mayor. I'll turn it back to you.
Thank you, Chris. And thank you, Dr. Nesbitt. With that, we'll take your questions. Yes, Julie?
If I may, I'd like to start with a public safety question and then vaccine questions. We have heard from some staff at the Capitol that they're thinking about permanently closing Independence Avenue and Constitution Avenue on either side of the Capitol. Is this something you've discussed with anyone there?
I mean, I don't think we should address like random staff comments. I think that the Capitol is undergoing a review, and we have certainly asked to be a part of that review, and we will comment during that review. Let me just say, though, as I've said previously, we want the lawmakers and the complex, of course, to be safe, but we don't think shutting down streets or leaving permanent fences is the answer.
Thank you very much. Dr. Nesbitt, we normally get the vaccine email that goes out to the city that says, appointments are available, and then just a few minutes later we get an email that says all of today's appointments are closed. We didn't get that email today. Does this mean that the 2,500 appointments didn't go in a few minutes this time?
So I'm still waiting on an update in terms of the call center. As you know, we are creatures of learned behavior and habit, and I think some of the rumblings that happen on social media and through other media outlets may not have people be as optimistic as of their opportunities to get an appointment. So when we make changes on a weekly basis, we want to keep people encouraged about coming to the website and coming to the portal, using the call center to get an appointment. When we made changes today to the website that would give people an opportunity to access at least 1,000 appointments via the call center, we noticed that people were not using the call center at the same volume. So it would be helpful for us if you all could encourage people to actually try every week to get an appointment. Our message has been very clear. We will have enough vaccine for everybody. We won't run out of vaccine. We don't expect to have a cap at some predetermined number that the federal government is only going to give the district X number of vaccines over X period of time in the long run. So when we want people to try every week to get an appointment and to get an appointment with us. So all of the vaccine appointments that were issued on the portal were actually allocated, and we still have had some available at the call center the last time I was notified around 11:30.
Great. So if somebody calls right now, they can get an appointment.
Possibly.
Great.
I've been here with you all for a while, so but we want people to try every week to get those appointments.
But let me just remind you, on the screen are today the priority zip codes are available on the portal, and it sounds like
That's correct.
the appointments via the web have been claimed, and if you call 855-363-0333 and you live in one of those zip codes, we'll accommodate you as long as there are slots available. Yes, Sam.
Another question for Dr. Nesbitt. The New York Times today is reporting virus in retreat. Is that the case here in D.C.?
So Sam, I actually also saw that article and took the opportunity to read it, and I think it gives us some optimism, but it also reminds us to be cautious, right, and to remain vigilant, just as I stated earlier. You'll note, and I know as I do, as some of you all do, I try to be mindful to watch the president's team's briefings that occur 3 times a week now around COVID-19, or to catch a summary of them. And yesterday, Dr. Fauci and other experts were mindful to remind us that until we have a full appreciation of how variants that have a higher rate of transmission will impact our rates here in the U.S., we should still be able to have some caution around our mask wearing, keeping our distance, and washing our hands. So while we are seeing trends in decreasing case rates, decreasing hospitalizations, and in many states and jurisdictions, declines in deaths that are reported on a daily basis, those are all things to give us hope and optimism that at the same time, coupled with a vaccination campaign that is picking up pace. But we need not reduce our vigilance in the things that we also know work, such as wearing our mask, et cetera. So I think we need to make sure that we still go slow and steady in terms of our quest to get back to normal, so that we don't compromise the success that we've made to date.
I see you're always cautious, but is there any indication that the levels are falling as far as you can see?
Well, pardon me if I didn't give you an answer that could be deciphered. So we are seeing declines in daily case rates, we're seeing declines in hospitalizations, and we are seeing declines in deaths. However, we are seeing a detection of a variant that has higher rates of transmission in more states in the United States. And until we have a full appreciation as to whether or not that variant may cause a rebound in those things that are going in a downward trend, we want the public to be cautious about their behaviors and continue to keep themselves protected. We have some things that are inspiring to us, right? A vaccination campaign that's picking up pace, and we have those numbers that are going in the right direction, but we don't want to get overzealous and compromise the progress that we are making. And I think that's critically important for people to know.
Mark?
Dr. Nesbitt, could you give us a few more details, any more details on the variants? Are the 2 people that have it, can you give us any demographics on them? Have they traveled? Are they hospitalized? And again,
what I know now, Mark, and I'm still working to get more details about the cases, what I know now is that it's not 2 cases. There are more than 1 case. There are 3 cases, is what what's been communicated to me, of the UK strain, and 1 case of the South African strain. Now, to put this contextually, you have to remember that every positive test is not sequenced to be detected for variants. Only sampling of cases are sequenced for variants. So just making sure that I give people some context that not every case that we report, so how we have over 38,000 cases of COVID-19 in the district, or how we've been reporting hundreds of cases on a daily basis, or our daily case rate has been averaging in the hundreds for the last few days. Not every one of those positive cases is sequenced either by the DC Public Health Lab or sent to the CDC for sequencing. They are sampling a number of cases, and so we've had some of the cases that have been sampled for sequencing come back as positive for this variant. You'll recall that I have asked our residents, and I've informed you all to think that this was a matter of not if, but when, given that both of these variants have already been detected in Maryland and Virginia, and we have very porous borders. So this is not surprising to DC Health, but just another opportunity to remind us to be very cautious about our behavior and our patterns here in the National Capital Region.
so if I understand what you're saying, that because they're just doing sampling, is it fair to assume that there are more cases than the 4 you know about?
But there's more cases of COVID in the district than I know about, because not everyone who has COVID gets tested. Some people are asymptomatic and they're never tested, and some people have mild disease and symptoms that they never get tested, which is why it's so critically important that we wear our mask, we keep our distance, we wash our hands, we avoid large gatherings. Those are the things that are critical for us to stay ahead of this virus.
And then just my last on the variant, do you know of the 4 cases that you're aware of, do you know if they had travel, international travel, or if this could have been a cases of community spread?
So again, we're still collecting that information. The way that this process works is that the CDC has little information about the context of these individuals, identifying information about these individuals. They simply are doing the sequencing, and then we have to do some work backwards to figure those things out.
So have those people been notified?
We are still doing work on these cases.
Thank you.
Yes, Amanda?
Yeah, and so two questions, or I guess a follow on that would be, is DC Health now going to issue guidance around face masks given the variant cases, and then also CDC's guidance from last night, people wearing more fitted face masks and wearing two?
So you'll be reminded that our guidance was updated last week. And this is, the CDC's did not issue guidance or a recommendation that people double mask. So in the public health community, we've been very interested in the different perspectives and interpretations people have made of the CDC's morbidity mortality weekly report, in that they have interpreted that as the CDC recommending that people double mask. The CDC conducted a study in a controlled environment of people wearing what's called a procedure mask, a medical procedure mask, with a cloth mask on top of it, and saying how that may have an impact on the amount of particles that can come through, what we call source control. What they cite in that report are limitations of that report. They did not examine the layering of multiple types of masks. So they don't examine cloth on cloth, medical procedure on top of medical procedure, or medical procedure on top of cloth. They also don't examine men who wear beards, right? So they talk about the limitations of that being generalized to the public and for generalized use. What they emphasize in that report is that people should wear masks that fit properly, and that for some people, putting a cloth mask on top of a medical procedure mask ensures a better fit. So I think we need to be mindful about that being considered guidance or a recommendation that everyone double mask and double mask all of the time. What we're clear about in our guidance is that some masks have better filtering than others. We've always been very clear about that. We're very clear that if you're wearing a cloth mask, it should have 2 or more layers. But the important thing is that people should wear a mask that fits and that is comfortable. We've seen people purchase N95 masks that do not fit properly, and wearing an improperly fit N95 mask is not helpful. It's not helpful to the wearer, and it's not helpful to the public. So those are the types of things that our guidance document speaks to.
Okay, and then questions about contact tracing. You mentioned the DC can again. I'm wondering how, we have it was like 600,000 phones who participated in this program. How would you describe, are you finding success with it? And then also I wanted to know more. I see now that one of our community engagements is in the red today. And so I wanted to know if you can talk a little bit about that in February.
Sure, we were mindful to highlight that we want people to answer the call. We have seen some declines in people responding within the time frame that helps us be the most successful, which is completing an interview within a 3-day time period. So we want to make sure that people are doing that. That is separate from people being enrolled in the exposure notification system. As you've noted, there are over 600,000 people who are doing that. We have used a number of tools, what's called geofencing, which I think some of you are aware of, that when you open certain apps, news apps, social media apps, we appear as a sponsored ad, advertising either the exposure notification tool or our contact tracing functions to encourage people to respond to the call or to enroll in those tools. And we have some people who are enrolled in the tool, and they do release their key for their people who have been around them to respond to, and we have others who do not. We have had some challenges with being able to get feedback from the Apple and Google teams in terms of exactly how many people who get a notification are actually following through. So those are things that we continue to refine with that program. But we do have a high proportion of people, as you've noted, who are enrolled, and we do have people who are actually sending out the signal if they test positive.
And any, Indy agrees, why are less people answering the phone? I mean, I guess you don't.
I would not
could-
know that, but I
Sure.
want them to.
Right, sure, okay, thanks.
All right, any other questions? Yes, Mark.
Yeah, Dr. Nesbitt, can you talk a little bit about, I know on the council call you mentioned, and you mentioned here today, you hope to get to 70% of seniors by March 1st and then start opening up to other groups like grocery store workers. Can you tell us, who will be the next group that will be able to start getting their vaccinations? And how are you defining particularly like grocery store workers as, people who work at Giant and Safeway or people who work at 7-Eleven or bodegas?
Yeah, so since you were on the council call, I think you already know the answer to that question, Mark. But I'll give it for the benefit, I think you may be asking for the benefit of others. So yesterday, I did inform the council that at the rates that we are going and with the demand that we have for seniors and the amount of vaccine supply we currently receive, which we believe will stay at this level or increase, we should be able to vaccinate 70% of our seniors by the end of the month. The only group that we believe we can onboard that won't compromise that goal are our grocery store workers, who are the remaining group in phase 1B, tier 2. And we define grocery store workers as those individuals who work in environments that are licensed and permitted in the district as grocery stores. And that includes the smaller grocers and delis. So not just those who are part of large retail chains, but also the smaller independent grocers and delis. It's been, they have this, to us, the same degree of exposure and risk. Our essential businesses and workers that will work whether we were in phase 0, 1, 2, or 3 to ensure that we had adequate food supply at our homes.
Do you know when that group would be allowed, and will they?
Well, we assess demand for vaccine on a weekly basis, and so we'll make updates when we're before you next week on Monday.
And will they get some kind of certification from their employer stating?
No, I also made that clear yesterday, is that we will not require attestations from people regarding employment or their health condition. Our goal is not to create artificial barriers for individuals to be able to access vaccines through our portal or through our healthcare providers.
Okay, last round, Julie and then Amanda.
I think the description of this new registration system as not a wait list is very helpful. And I was hoping you could help people understand more. When they get a notification from this new system, will it say, here's a link, click now and claim your appointment? Or will it be like it is right now where there's still a big batch of appointments at once and it says, click and try to get one of this?
It will not be a big batch. Well, it's a combination of both, actually. So we get our vaccines as a big batch. And so we will notify people in batches. So that's the big batch part of it. But they will have a defined period of time that they will be allowed to come in and schedule an appointment at a location that is hopefully convenient for them. And so it creates more convenience in the process. So we are always looking to be responsive to the ways people have given us feedback in terms of how the current system works. So hopefully next week we'll be able to make some changes where initially we got a lot of feedback from you all, often not positive, about can we have just a standing time about when we release appointments? Well, 9 a.m. doesn't work for everybody. We have people who have jobs that they can't come off of their job assignment to go to the website and claim appointments, and so we're going to attempt to be flexible for that beginning next week. So this newer system, when it goes live in March, will be able to be flexible and accessible for people 24 hours a day online. And then the call center will also have hours that tend to go outside of a traditional 8-hour workday.
So that batch of emails will go to about the same number of people?
It will not go to the same number of people, all at the same time, Julie. because what we are doing is we're creating equity in the process. So it gives people an opportunity to accept or decline. Maybe they've gotten vaccinated somewhere else. Maybe they've gotten vaccinated at their healthcare provider. It allows us to move to another person.
Right, what I was trying to ask is it the same number of people roughly as the number of doses available? It's not a big competition anymore.
Okay, so let me give you maybe the most concrete example I can give you. If we get 3,000 doses of vaccine, I would not notify necessarily 3,000 people all at the same time. We may break it down and notify a subset of those people, give them an opportunity to say yay, nay, and then roll to the next group of people, et cetera, in increments of time that would allow people to accept or decline. Hopefully that's helpful enough to paint a picture for you about something that's going to happen 3 weeks from now.
Very helpful, thank you.
I understand, based on yesterday's council call, that you're setting, or DC
You
office.
all love the council call.
Yeah. It's helpful, so we
You
know-
have 4 press conferences a week or 3 press conferences a week. and
We'll
you'll-
work
This
on
is very
that.
complicated stuff, right? I imagine the more
So
information.
what is your
Yeah.
question?
Sure. Vaccine doses are set aside for door knocking, right? So I wondered how many were set aside for the Ward 8 door knocking, and then I also understand you piloted a program in Wards 1 and 4, and so I wanted to know how many were set aside for that.
Can we get back to her with that one?
Sure.
We'll get back to you.
You'll
with
get
that.
back to, and then, sorry, one last question. Just so I can better understand how DC moves through the phases and tiers of vaccine. So I understand, right, it's like 2 tracks, one preventing mortality and morbidity and the other keeping society going. So once we vaccinate the seniors, is it expected that we'll move on to this next cohort?
So on the council call yesterday, when I was asked this question, I informed and responded, as you'll recall, that we've put in a request to FEMA. And so based on how they respond, I'll be making decisions about how we'll move past phase 1B tier 2.
Okay, thank you.
So the answer remains the same as yesterday.
Yes.
Just one for the doctor and one for you, Mayor, off topic for you, Mayor. For Dr. Nesbitt, can you just talk a little bit about how the faith-based vaccine program, I believe it's rolling out today, is working? And then for you, Mayor, I just had a question about Speaker Pelosi's comments today about, in light of what they're learning through the investigation and the impeachment process of January 6th, the need for you or the mayor of DC to have full control over the DC National Guard.
I'm afraid I didn't hear her comments. I came out of a long meeting before I came here. What was her comment?
Well, she just basically echoed what you have been saying, is that, you know, the mayor of DC should have full control over the DC National Guard, and had you had that control on January 6th, it may have led to a swifter reaction at the Capitol.
Well, I certainly agree with the speaker if that's what she said, and she has a very good understanding about our needs in the district, I would say, and that is something that is tops on our list on our way to DC statehood. It's not something that we want and then we're going to give up our statehood fight, but it is certainly part of the process and is something that our Congresswoman has advocated. I think she has a current bill pending that would do that. So not only can the members of Congress talk about it, that bill can move.
And then Dr. Nesbitt, just about the faith-based program.
Sure. I had the opportunity to go over and visit with Reverend Curry over at Pennsylvania Avenue this morning. They have a well-structured program that is occurring there today. People were out. They were very appreciative of the fact that the faith-based partnership was going. They have videos that they are running to be able to answer questions. They have people on site providing vaccine counseling and education in addition to administering the vaccines. And they're going to offer the vaccines today and again on Saturday. The goal is to be able to vaccinate 200 people on those days combined. And then they'll have a session early next week to talk about how the operation went, any process improvements as the pilot may come to scale with other places of worship throughout wards 5, 7, and 8. So I'm very excited about what's happening there today. We'll continue to monitor the program and make plans for moving forward.
Is that it? After this week, it's not continuing?
So our goal is to have it actually be a faith in vaccines initiative, but we're going to, and we've identified other places of worship in wards 5, 7, and 8 that can participate, but we started with just one site today to be able to understand operationally how it works, how the community would respond to it, and we'll do some debriefing early next week with Reverend Curry, the other leaders from places of worship who have been identified as wanting to participate, and then we'll make our plans for scaling up after.
All right, thank you.
Thank you.